So our session was on what new data do we have on combination therapy or monotherapy in Staph aureus infections, and I think there was a great talk from Annelies Sinkernagel who showed that there may be some new approaches from in vitro testing to then decide on treatment, whether combination treatment or not, from a better informed state actually.
So I think we heard some very nice talks from Mikhail Pujol and as well as Stephen Tong regarding the challenges that we have with respect to existing data regarding the role of combination therapy for the management of Staph aureus bacteremia. Lots of clinical data out there, but we don't have any definitive data from well-designed clinical trials, although there are a number underway. And I think that the jury is still out in terms of what the best treatment options are. There's some exciting new trial designs that Dr. Tong presented, adaptive randomized trial designs that I think will be very interesting and hopefully informative for us in the future as we evaluate the question of the optimal therapy for Staph aureus bacteremia. Well, I think Staph aureus is always one of those areas where there's lots of interest, lots of questions. I think people are still struggling on what the most optimal therapy is. So I think very excited to see such excitement and such interest in this session.
I mean, it's such a major pathogen, and at least on our service, it's about 40% of questions that we are asking are on Staph aureus, so that's why this enormous interest. I think the last talk of Bernadette Young was also excellent, because there's now we are getting insight on genetic traits of Staph aureus, and we've heard it's very hard to study. We need very fine methods and a lot of isolates to get definitive answers there.